Okay, welcome back to Rapid Response, brought to you by Apex Benefits Group and our sister company, Axiom Human Resource Solutions. I'm here with Brooke, Salazar, Andy Zelt. My name's Todd, Rokita. I am the General Counsel and Vice President of External Affairs at Apex Benefits, former U.S. Congressman for the state of Indiana. And Brooke, could you tell us a little bit about yourself?
Sure. Prior to becoming a lawyer, I was an HR professional as well, and so I really enjoy walking you guys through this.
My name is Andy Zelt, founder and CEO of Axiom Human Resource Solutions, a local-based payroll and HR timekeeping solution firm in Indianapolis using Workforce Ready.
All right, so today we're going to talk about the CARES Act still. We have several installments about it. The bill passed now just a couple hours ago. It's Friday, March 27th. It's the Phase 3 bill. It's the third and latest installment from the federal government, U.S. Congress, dealing with the COVID-19 coronavirus pandemic. In addition to this bill's small business administration provisions, in addition to the employment provisions, in addition to the tax provisions, there were also some health benefit plan expansion provisions in this. And as Apex Benefits is the state's largest health care benefits provider, both private sector and public sector, I want to take just a few minutes to go through what we're seeing in the bill so far about health benefit plans. The first point I would say is that the group health plans and health insurance issuers are going to be required to cover, without cost sharing, any qualifying coronavirus preventative service. So it is now in federal law that the plans have got to cover, without cost to the patient, the coronavirus preventative service and the testing. So what does that mean? What is a qualifying coronavirus preventative service? Some may be asking. Well, it's not that complicated. It's simply it means that an item, service, or immunization is one, intended to prevent or mitigate COVID-19, and that it's an evidence-based item or service as determined by our federal government, or it's an immunization that has that same kind of recommendation from the Center for Disease Control. That's the first one. Pretty simple, pretty straightforward. Andy and Brooke, the other thing I would say is that 518 of ERISA is being amended by the CARES Act to prevent the Secretary of the Department of Labor to provide extensions of certain ERISA compliance deadlines in the event of a public health emergency as declared by the HHS Secretary. So basically this means the same kind of notice extensions for your plans that may be extended when there's a hurricane or other disaster are now being applied to the coronavirus. Some other things. We've talked a lot, as you guys know, about telehealth during this virus. Well, what's the interplay between telehealth and health savings accounts?
So a health plan shall not fail to be a high deductible health plan or an HSA if the plan covers telehealth and other remote care services without the application of a deductible, which is a big shift. So I think that's really exciting for those folks that can't and won't be able to get to the doctor.
Yeah, so that's Section 3701. That's for plan years beginning on or before December 31st, 2021. So that should be everyone in the here, every plan in the here and now. Not going to fail the HSA if the healthcare deductible is waived. So that's all good stuff. Over-the-counter medical products without prescription. Andy, a lot of your clients' employees and your clients themselves, they are going to get over-the-counter supplies for either quarantining, social distancing, other things like that. You don't need a prescription from a physician anymore to have your HSA pay for those kinds of items. So a real relaxation so far we're seeing of the HSA requirements as it pertains to telehealth, as it pertains to over-the-counter, and then, of course, the testing itself covered by your plan now.
So I can get Tylenol that I can't find in a thermometer and get my HSA to pay for it?
Yeah, without getting the doctor's prescription. That's how we're reading this. So Section 3703, if you can go all the way back to the Phase 1 legislation, which was that very small, in retrospect, $8.3 or so billion bill, there was actually a limitation on telehealth where you couldn't expand coverage of telehealth for COVID-19 purposes if you had been to a telehealth professional or service, I think within the last 3 years or so. That's all changed and corrected, if you will, with the CARES Act 3703. They're expanding the use of telehealth because obviously we don't want people crowding hospitals that are sick. We want them to get care. Now, of course, telehealth won't help you with the initial testing, but it can help with other services, prevention, perhaps, and also treatment. So flexibility there to have your plan cover those kinds of things. Again, with the bill only passed about a couple hours ago, that's what we're seeing when it comes to health benefit plan expansion. Thank you very much.